Prozac is one of 30 antidepressant probes by the UK watchdog over links to suicide. I'm going to read into this exclusive from The Independent, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from The Independent with the headline of Prozac is one of 30 antidepressant probes by UK watchdog over links to suicide. The exclusive reveals that the Medicines and Healthcare Product Regulatory Agency is looking into the effectiveness of side effect warnings in relation to the most commonly prescribed antidepressants on the UK markets. Guys, while you're here, make sure you hit the like button and share across social media so others are notified of this video. So this is obviously, we're talking about something that could be linked to suicide. Now, I did know somebody who used to take this precise medicine. I'm no longer in contact with the person, I'm afraid. But at the time, she was taking it to cope with her issues, which I will not reveal. But I obviously tried to help and support her as a work colleague as much as I possibly can in the environment that we were in. And at one point, she actually, I think the last time I was in contact, she actually got off them, which was a good sign. And I honestly have no idea whether that person went back on them or not. No idea. I have no idea whether the person went back on them or not. Now, I have suffered from depression and in times in my life, and even some people have suggested me taking antidepressants to help counter it sometimes. And now I'm going to be flat out honest with you. I don't personally want to go anywhere near them, no matter how depressed I get, because my worry is that the moment I take one, I feel like I'll be able to take more. Now that's just my personal preference. That doesn't mean it should be something that everyone should do. That's just my personal preference, my personal opinion. Now, if for yourself, it may be something different, and maybe you should consult with a doctor or a GP yourself. Now, I don't suffer as much with depression like I used to, but I have suffered it in the past. It doesn't mean to say that I won't suffer it in the future. But it's a question of whether you feel like that everything is going so bad that you need something to help you out. And that's where the antidepressants come in. Now, there's obviously side effects to them, some more than others. Now, this exclusive obviously says that one of 30 antidepressants have been linked to suicide. And obviously, anything linked to that is obviously a great deal of concern. But how do you strike a balance, in my opinion, where antidepressants help keep people keep people off from being depressed, whatever going on in their life, then from those who refuse to take it, that continue to be depressed, and that could lead them to suicide. See, that's the kind of the balance that I'm struggling to find myself here in. Because if it is true that antidepressants are that some antidepressants are linked to suicide, then questions about their integrity and questions about what they actually do, the side effects of them, have to be questions about whether or not they're even okay. They shouldn't be safe at all. If they have links to suicide, they should be completely taken off the counter, in my opinion. But the reality is, we just, at the moment, until we read this article, we don't know that for sure. So let's read more into this to get a better understanding of Prozac and antidepressants, guys. So more than 30 of the most common antidepressants are used in the UK are to be reviewed by the UK's medicines regulator, as figures point to hundreds of deaths linked to suicide and self-harm among people prescribing these drugs. That's, okay, more than 30, that's a major cause for concern. The medicines, which include Prozac, are prescribed to millions of patients, will all be looked at by the Medicines and Healthcare Product Regulatory Agency, the MHRA. It follows concerns raised by families in Britain over the adequacy of safety measures in place to protect those taking the drugs, such as warnings against potential side effects. The regulator will look into effectiveness of the current warning, according to a letter from the mental health inspector Maria Caulfield, which has been seen by the Independent. There has been a huge rise in the use of antidepressants in England, with 85 million prescribed issued in 2022-2023, up from 58 million in 2015-2016, according to NHS figures. Nigel Crisp, a crossbencher peer and chair of the Beyond Appeal all-party parliamentary group, told the Independent that overprescribing of antidepressants has an enormous cost in terms of human suffering. Because so many people become dependent and then struggle to get off them, it wastes vital NHS resources. The review comes as it emerges that more than 515 deaths have been linked to these drugs, involving suicidal identification and self-harm, have been made to the MHRA since the year 2000. These alerts don't directly confirm the cause of person's death. Some antidepressants can be given to children as young as 4. And sum total cost of medicines to the NHS in 2022-2023 was more than £231 million. Side effects may include of many antidepressants can include suicidal thoughts and anxiety, according to the National Institute for Health and Care Excellence, that's NICE. This is considered uncommon. One mother, Leroy Richardson, called on the regulator via the Independent to review safety measures around the drug Mizpapine, apologies if I mispronounced it, after her daughter took her own life 2 weeks after being prescribed to it. I'm sorry to hear that. The regulator confirmed to the Independent that the expert warning group will look at 30 different medications, including fluoxetine, the generic name of the drug sold under the brand name Prozac, as well as lifuranium and catopram. If I mispronounce any names, I apologise. According to MHRA data, fluoxetine has prompted 9,237 serious and false and fatal alerts relating to adverse reactions since the year 2000. Of these, 438 related to suicidal and self-injurious behaviours, and 286 were linked to anxiety symptoms. Data suggests there have been 73 fatalities linked to suicidal and self-indulgence behaviour in patients taking fluoxetine in the last 2 decades. The data does not confirm that the drug was a direct cause of death. Last week, the Independent reported Miss Richardson's call for the regulator to review safety measures around Mizpapine after her daughter Rebecca Cusia took her own life 2 weeks after being prescribed the medication. Mizpapine, which was given a black box alert in the US due to its possible side effects, has been subject to 59 alerts linked to suicidal and self-injurious behaviour. This led to the US regulator placing clearer warnings on the packaging. This will be included in the MHRA's wider review. In a letter to Ms. Richardson, Ms. Caulfield said the MHRA's review will look into the effects of the warnings provided to patients who are prescribed antidepressants. As the use of antidepressants soars, the most recent NHS data from March 2023 to December 2023 shows that 331,000 patients between the ages 10 and 19 were prescribed an antidepressant during that time, up from 240,000 during that same period in the 2015-2016. Last year, the Beyond Pills APPG called for the government action to reverse the increase in prescription of these drugs. The thing is the question that the more I read into this, the more I think about why are we not doing more in terms of therapy than actually just dishing out drugs? Is when I stop and I think about this and I'm like, why are we not doing more when it comes to help, as in giving these people help as opposed to just simply throwing some pills at them in a case to just help them get over it? That's more of a question. I know everything costs money. But surely, the answer isn't always drugs. Therapy can make a massive difference in this as well. And I think we need to do more. I know, obviously, the Labour Party said they're going to be looking at improving the mental health in the NHS when it comes to power as well. That's one of its targets as well. And I do think that will help. But I just feel like if they can't afford real help that they need, they turn to drugs as something just to kind of get them by, sort of thing. and they end up becoming addicted to it, and obviously can lead to worse things. James Davis, Associate Professor of Psychology at the University of Roehampton and a member of the Beyond Pills APPG, warns that the provision of social and psychological alternatives to medication is insufficient. While 8.5 million people were prescribed antidepressants in 2022-2023, only 1.2 million people commenced so-called taking therapy. Let's see, here we go, right here. 8.5 million prescribed antidepressant. Only 1.2 million took so-called talking therapies. Yeah, this is here. This is where the problem is here. This is the easier way out for people. We have over 85 million prescribers of these drugs each year in England, and that figure grows yearly, says Professor Davis. Another concern is not only that we are seeing vaulted rates of prescription to the general population, we're seeing the average duration of time given to persons spending on these drugs increasing as well. One of the reasons for this is there is still insufficient provision for social and psychological alternatives in the NHS. Professor Davis warned that patients are not being adequately followed up once they have been prescribed those medications. He added, we should not be prescribing these psychotropics to young people. We should not be providing young people with the psychological and social. We should be providing them with young people with psychological and social support necessary to enable them to overcome these difficulties that they're encountering. Yeah, if you can do it without the needs of medication, there are many. I believe there are a lot of these cases where it's a simple case of simple talk down, simple therapies, and discussions can be much better than simply turning them to medication. The MHRA said it could not confirm the scope of the review or what actions had been taken as a result, as it was still convening its panel of experts. It told The Independent, we are currently finalising the core membership of the expert working group considering risk minimisation measures for antidepressants. I anticipate their first meeting will take place in July. The group will be considering all antidepressants on the UK market. Professor Davis highlighted concerns of the regulatory's ability to conduct a review. He said, the MHRA is far too close for the industry to be objective for this review. In my view, it is 100% funded by the pharmaceutical industry. There are serious concerns about what we call regulatory capture, which is far too close to the industry and its purpose for independently regulate. If that is the case, then this is already compromised. Any kind of influence by the pharmaceutical industry, if the pharmaceutical industry is influenced by MHRA, it means that allowing these pills to be the solution to people as opposed to actually therapy, because they want to make money, because that is the bottom line for them at the cost of people's lives, then that for me makes the MHRA already compromised, if that is the case. An MHRA spokesperson said the agency had robust confidence of interest in mechanisms covering MHRA staff, board members, and those who give independent expert advice on MHRA committee, adding, these mitigate any potential conflicts of interest efficiently. Dr. Amit Anwar of the Association of British Pharmaceutical Industry, the ABPI, said that companies support ethical and evidence-based prescribing and want to help healthcare professionals and patients reach sensible decisions on the best treatment. The Department of Health and Social Care spokesperson said that talking therapies constitute the recommended first-time treatment for depression, and that the program to improve access to these treatments will expand to treat 384,000 more people over the next 5 years. It added the decision to prescribe a particular product is a clinical one and should be based on the patient's medical needs, taking into account NICE guidelines, which recommends not routinely offering antidepressant medication as a first-time treatment for less severe depression. Eli Lilly, which manufactures Prozac, told The Independent, there is nothing more important to Lizzie than the safety of our medicine. For decades, Lizzie has been submitting fluent safety data to regulatory authorities around the world, including the MHRA and FDA. Fluctuating is approved by the MHRA, and FDA continues to be considered to have positive benefit-risk profile by regulatory authorities for physicians and patients around the world. Yes, but these products can also be can also do the opposite. So there are positives and there are negatives to antidepressants. Like for me personally, I know, but I know some people don't agree with me, and that's totally all right. But for me, I think antidepressants are dangerous. I really do. I think they should only be. I think, in my opinion, and this is my opinion, I think they should only be used as a last resort if therapy doesn't work for them. If they can't get therapy, there needs to be ways that they can be done for them. I know every case is different, and that's totally understandable. But I generally believe that antidepressants should always be the last resort, not in all situations. I feel, because of the side effects that could occur. That's my general belief, and you're more than willing to correct me wrong on that. But I personally don't want to go anywhere near antidepressants, no matter how depressed I ever get in my life, because of the fear of being hooked onto them. And obviously, this article kind of reinforces my belief about antidepressants. Even if antidepressants, yes, have made a difference to people's lives, there's no question that some people's lives are better off because of antidepressants. I'm not dismissing that at all, but I know some people will think that that's what I'm doing. Like I said, every case is different. But me personally, I don't want to ever go near them. But my general consensus is that more needs to be done that allows people to be able to seek therapy, to be able to have those deep talks, deep conversations about why they're feeling these feelings, what the pinpoints of these feelings are, where they start from, why does it make you feel these ways, what is it that triggers these impulses that make you feel depressed, all these things. And then it's broken down from there within the deep talks of therapy and psychological help that these people can get in order to help them overcome and understand why they feel these feelings and what they can do to overcome them, as opposed to just simply taking something to help. Yes, I'm fully aware of the situation that the country is in with the cost of living crisis and everything else. I'm fully aware of that. I don't need to be reminded of that. But I still believe that antidepressants can have the wrong kind of side effects on some people. But we'll obviously have to keep an eye out and see what happens with the regulatory in June of what they say from this, you guys. But what do you guys think? What do you guys make of Prozac? What do you make of some of these these antidepressant pills? What do you guys make of the pills or medicines, whichever you want to refer to them as called? Do some of you take them yourselves? What do you generally believe? Do you believe that they actually help you? Would you rather have gone to therapy if you could afford it, or if it was free? Would you have taken therapy yourself if you're someone who's on antidepressant pills? Or maybe someone you was on it and now off it and now better off. Maybe you can let me know your thoughts about it in the comment section down below. Share all your thoughts and others down there, guys. If you found this video informative, please hit the like button. We greatly appreciate it. Share this across social media so others are notified of this video, and subscribe because it really does help support the channel. Thank you all so much for watching. I hope to catch you all very, very soon.